Oh, hi. Sorry, I didn't see you were already here. Hi, my name is Csilla. Nice to meet you. How are you today? Good, good. I'm glad to hear that. So you came for the face assessment, right? Yeah. Okay. So just please sit down, make yourself comfortable, and I will start with asking a couple of questions. Some things that I need to know before I assess your face. Then I can do the assessment and also some treatment if necessary. Yeah. Okay. All right. So first, I wanted to ask if you have a specific problem that you came here with, or you just want me to assess your face and see if you have any sort of issues. Like small dry patches or the big itchy ones. Small ones. Okay, that's no problem. Most of us have these at least a couple of times throughout the year. So that is usually caused by either the lack of moisturizer or not the right type of moisturizer. So usually when you find the right one for you, it all goes away. So also, I wanted to ask if you wear makeup regularly on a daily basis. I can see that you're wearing a slight makeup today, but is that an everyday thing? And when it's time to go to bed, do you usually wash it off or yeah, okay, that's good. A lot of people go to bed with makeup on and that is so unhealthy for your skin. So that's good. Yes, you should always wash it down very thoroughly. Yeah, and the last thing I want to know is if you already have your skincare routine or just moisturizer. No. That's perfectly okay. A lot of people don't even use moisturizer, and that's pretty much the most important thing. So that's very good that you're already using it. I would suggest you try a couple of serums, some other products. I always say that it's never too early to start having a skincare routine. Yes, I can suggest you a lot of different options depending on how much you want to spend on it, and you can also buy things in our shop. So, yes, I will show you everything afterwards. Okay. All right, so let's start the assessment right now. At first sight, I don't see a lot of problems here, but let's see. Let's take a little closer look. So I wanted to ask if you prefer me using my hands or you want me to put some gloves on. I have rubber gloves or I can just use my hand. Yeah, I can use my hands, absolutely. Yeah, a lot of people just don't like the touch of rubber gloves on their face for some reason, so I will only use it when I'm applying the treatment, okay? All right. So first, I'm just going to go through your face, see if you have any spots or irregular textures, and then we can just check the smaller parts of your face. Okay. Okay. Yeah, it seems to be pretty nice. I have to say that you have a nicer looking skin than most of my customers. Yeah, it is pretty well treated, I must say. Looks like it's been taken care of. All right, so let me just see if there are any small patches that need to be treated. Yeah, I can see a small dry patch here. Yeah, we'll apply some moisturizer here. Yeah, let me see if that's also a problem on the other side. Yeah, I can tell. I can tell. No, it's nothing big. I think it can easily be treated. And let's see your forehead. Yeah, also some dry patches here, but not really bad. It's just, yeah, here, this point here. Maybe it's just in the T-zone, which is weird because it's usually the most oily part of a face, and for some reason it seems like you have it pretty dry in your T-zone. Yeah, okay, so we're going to put some treatment on there as well. Yeah. Okay, see under your eyes. Yeah, it's a little bit puffy, but that might just be genetics. You can't really say from just looking at it like this. It can be something that just comes from your genetics, but also it can come from the lack of sleep. So I don't know. Do you sleep well? Do you sleep a lot? Yeah. Maybe you should start sleeping more, because that can help a lot with the puffiness under your eyes. But I think we have the right kind of serum for that as well. Okay, let me just see how elastic your skin is in different spots. Okay, that seems to be pretty normal, especially for your age. So no problems there. Do you have any problems with your hair? Is it thinning? Is it falling out anywhere? Here? Right here, above your forehead. Okay, let me check that. Yeah, I can see some thinning here. That also doesn't seem like a huge problem, but it can also be caused by a lot of other things. So I think it's worth maybe going to a doctor's checkup to have it checked. Let me check that with some lights. Okay. Let me just check, because for me, it seems like there might be a bigger problem here than just a thinning hairline, but yeah, I need to double check. No, you don't need to worry. I'm sorry if that sounded I'm sounded like you have to worry about that. It's not that kind of big problem. It's just, I just meant that probably some kind of food allergies or intolerances or things like that. Maybe it's not just a genetic thing. Sometimes it's genetic, but many times the reason behind it is thyroid problem or some kind of a food intolerance. So that's why I'm checking. Yes, I think it's best to go and have it checked. because I won't be able to say it 100% just by looking at it. So yeah, I would go to the doctor and have it checked. Also, let me see the texture of your skin. It seems to be pretty good. You don't have a lot of wrinkles, even fine lines, which a lot of people in your age already have. Yeah, your skin looks really nice, actually. Apart from those couple of dry patches, it actually looks really nice. So I think I will just do some treatment on the dry patches that we found in your T-zone, here on your cheeks and on your forehead, okay? Okay, so first off, is it okay if I remove your makeup? You're not going anywhere from here. Okay. Yeah, I just didn't want to mix it with the treatment. But okay, good. Then I'll just remove it. Thank you. Okay, so I have my remover here and also reusable cotton pads because we are sustainable here. Yeah. Okay, close your eyes. All right. Your other eye. Good. Are you also wearing some foundation or just the eye makeup? Yeah, okay, that's good. Then I'll just clear the rest of your face. Yeah, good. Is it taking long? No, this is how long you should do the cleaning. Yeah, every single night. That's what I meant when I said you should do it very thoroughly. You should spend like 2 minutes just with cleaning your face. Yeah. I know. We're all rushing all the time, so probably it's not something you think of, that you're gonna spend 2 minutes just washing your face. Okay, so first I'm gonna apply an eye treatment. That's a serum using snail gel. You haven't heard of it? Oh, they say it does wonders, and it's also really good for puffy eyes. So I'm just gonna take it here. So here it is. It's that small, but it goes a long way. So I absolutely recommend this. It says organic snail gel, but also I will need to wear some rubber gloves for this one to make sure that it's as hygienic as possible. No, really, a lot of people ask me not to wear these because they just feel it's weird how it touches their face. I don't mind. I don't know why other people don't like it, but I understand. So I'll put a tiny amount on the back of my hand, and I'll put this on your face under your eyes. Yeah, please close your eyes just for a bit. Thank you. Your other eye. but we're concentrating on your under eye area because that's what has the puffiness. Yeah. Okay. When you rub it a little bit, just in circular motions, it helps. If you do it every day, probably like 2 times, maybe in the morning and then in the evening, if you rub it gently under your eyes with some kind of a serum like this one, it can help you tremendously, really. It did help a lot of my customers. Yeah. So just do it like this. Do it how I'm doing it right now. Massage it gently. Like this, yeah. You can use your thumb as well. Okay, so now I'm gonna use the actual treatment on your problem, which is the dryness in your forehead and on your cheeks. And this is a very strong moisturizer. I used it on a couple of people who had the same problem, and it helps a lot even after using it once. I would suggest you buy that and then probably use it just once every week because it is a very strong moisturizer. So you don't need that kind of moisturizing every single day, but as a treatment, you could use it once every week. Yeah. Okay, so I'll bring it here. So this is how it looks like. It is a Korean product and it's actually a little bit on the pricier side, but since you only have to use it once every week, it will last like a year or a year and a half. So I would definitely suggest this one. And you don't even have to use a lot of it. It's enough if you just use it on the dry spots. Yes, like there on your cheeks. Again, use circular motions like that. A little massage. Yeah. Yeah, like that. Good. Okay, I will also put some oil on your roots, on the place where your hair is thinning a bit. I'm not sure that will help, so definitely go and have it tested. Have yourself tested for some allergies and intolerances. But I will try. Maybe this treatment works. It works for some people, but you still will need to go and get yourself tested. Okay. All right. So this is actually a miracle hair serum. That's what the label says, and it actually is a miracle serum. I've had a customer once who had a really bad hair loss, and she bought this oil, and she applied it every second day, and her whole problem was solved. It was so great to watch how her hair started to grow back. She was so happy. Yeah. Okay, just putting your hair away a little bit. Sorry. Oh, I have a hair here. I think it's mine. Come on. Yeah, let's go. Sorry, I'm trying not to put the oil on your hair so that it doesn't get very greasy, but fortunately I need to put the oil as deep as I can. So I can guarantee that I won't get a little bit on your hair as well. Okay, let me know if this works for you. You will probably be able to tell the difference in a week or two if that had any impact on your hair growth. And if it did, just come back and you can buy it here and then you can use it on a regular basis. Okay, yeah, let me just take off the gloves. I'll be back in a second. Okay, so luckily we haven't found any big issues with your skin. Yeah, your skin looks great. It looks great. If it's just genetics, you're very lucky. Yeah. So before you leave, you can check the shop and you can take a couple of products if you want. I can help you with building your skincare routine. Yeah. So, yeah, thank you very much for coming. I hope you enjoyed it. Yeah. Okay. All right. So, if you want to have another appointment, you know our number. You can just call us and you can come back to me, and then we can talk about how to upgrade your routine, see if all these things help you. Yeah. All right. Yes, it was very nice to meet you. I hope you'll have a great day. Okay. Yeah. See you next time. Bye.